The Chernobyl disaster was a catastrophic nuclear accident that occurred on April 26, 1986, at the Chernobyl nuclear power plant in Pripyat, then part of the Ukrainian Soviet Socialist Republic in the Soviet Union. It is considered the worst nuclear disaster in history, both in terms of cost and casualties. Key events leading up to the disaster. 1. Reactor design flaws. The Chernobyl plant used RBMK reactors, which had a dangerous design flaw. These reactors were prone to instability at low power and had a positive void coefficient, meaning that an increase in steam production could accelerate the reaction instead of slowing it down. 2. Safety test gone wrong. The disaster occurred during a late-night safety test in reactor No. 4, which was intended to simulate a power outage and ensure that the reactor could still be cooled if the plant lost power. The test was poorly planned and executed. 3. Operator error. The operators, unaware of the reactor's design flaws, made several critical errors. They disabled safety systems and allowed the reactor to operate at dangerously low power levels. When the test was finally conducted, the reactor went out of control. The explosion and immediate aftermath. Explosion. At 1:23 a.m., the reactor's power surged, leading to a massive explosion that blew off the reactor's 1,000-ton steel and concrete lid. This exposed the reactor core, releasing a large amount of radioactive material into the atmosphere. Fire. The explosion ignited a fire that burned for 10 days, further spreading radioactive contamination across Europe. Initial response. Firefighters and plant workers, many of whom were unaware of the radiation risks, attempted to control the fire and contain the damage. Many of these first responders died within weeks due to acute radiation sickness. Long-term impact. 1. Radiation release. The explosion released about 400 times more radioactive material than the atomic bomb dropped on Hiroshima. The most significant release involved iodine-131, cesium-137, and strontium-90, which have long-term health effects. 2. Evacuation. Pripyat and surrounding areas were evacuated within 36 hours. Eventually, a 30-kilometer exclusion zone was established, displacing around 350,000 people. 3. Health effects. The disaster led to an increase in cancer rates, particularly thyroid cancer, due to exposure to radioactive iodine. Estimates of the death toll vary widely, with some reports suggesting thousands of deaths due to long-term effects. 4. Environmental impact. The region around Chernobyl remains heavily contaminated. The Red Forest, so named because radiation killed off large swaths of trees, is still one of the most radioactive places on Earth. 5. Sarcophagus and new safe confinement. To contain the radiation, the Soviet government quickly constructed a concrete sarcophagus over reactor number 4. This was later replaced by a more durable new safe confinement structure, completed in 2016, which is designed to last for at least 100 years. Lessons learned. Nuclear safety. The Chernobyl disaster highlighted the importance of reactor safety design, proper training for nuclear plant operators, and the need for transparency in reporting and managing nuclear incidents. Global impact. The disaster led to changes in nuclear energy policies worldwide, with some countries abandoning nuclear power altogether, while others strengthened safety protocols. The Chernobyl disaster remains a stark reminder of the potential dangers of nuclear energy when not managed correctly. and its legacy continues to influence global nuclear policy to this day.